नमस्ते बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. Today, we are going to discuss a very important topic related to the cardiovascular system. Although this topic is related to many other systems like the endocrine system, like the genitourinary system, and so on. So let's start with hypertension. What is hypertension? Uh, you must have seen a lot of patients of hypertension in your day-to-day life. There must have been patients within your family, in your neighborhood, and you must have seen lots of people saying that they are suffering from hypertension. So what is hypertension? What are the normal limits? And what are the various investigation, causative factors, and management we are going to discuss in today's lecture. So this is a very important topic today. So let's start now. Hypertension is a condition in which the arterial blood pressure is chronically elevated. So in hypertension, the blood pressure is chronically elevated. The definition of hypertension is the blood pressure. The optimal range is less than 120 systolic and less than 80 diastolic blood pressure. The normal range is less than 130 systolic and less than 85 diastolic. And the high normal range in case of systolic blood pressure ranges from 130 to 139 mm of Hg, and the diastolic range varies from 85 to 89 mm of Hg. So these are the various normal ranges of normal blood pressure in an individual. Now hypertension, when it is said hypertension, so grade 1 is mild hypertension in which the systolic blood pressure ranges from 140 to 159 mm of Hg, and the diastolic blood pressure ranges from 90 to 99 mm of Hg. In grade 2, the moderate blood pressure ranges from 160 to 179 mm of Hg, and the diastolic ranges from 100 to 109 mm of Hg. The grade 3, that is very severe hypertension, where the systolic is greater than 180 mm of Hg, and the diastolic blood pressure is greater than 110 mm of Hg. So these are the normal ranges and abnormal ranges when hypertension is called. What are the different grades? Grade 1, 2, and 3. And now we come to the etiology. The etiology of hypertension. In greater than 95% of the cases, specific underlying cause of hypertension cannot be found, and it is known as essential hypertension. So you must always remember that all the patients that are coming to you, in greater than 90%, 95% of the cases, you will not be able to find any cause, and those patients will be called as essential hypertension. In 5% of the cases, hypertension are the consequence of specific disease. So if hypertension is as a result of some other disease, then it is known as secondary hypertension, and you will find these causes only in 5% of the cases suffering from hypertension. Now, what are the various factors that are responsible for the development of hypertension? The various factors that are responsible are, number one, these are the factors for secondary hypertension. So factors are renal dysfunction, if the kidneys are not functioning properly, peripheral resistance vessels tone, endothelial dysfunction, autonomic tone, insulin resistance, neurohormonal factors, genetic factors, and environmental factors with high salt intake, heavy consumption of alcohol, obesity, lack of exercise, stress, and impaired intrauterine growth. So there are various factors, like I will again repeat these factors: renal dysfunction, peripheral resistance of the vessel tone, endothelial dysfunction, autonomic tone, insulin resistance, neurohormonal factors, genetic factors, and various kind of environmental factors like high salt intake, heavy consumption of alcohol, obesity, lack of exercise, stress, and impaired intrauterine growth. Now we come to the secondary hypertension. What are the various causes of secondary hypertension? We have alcohol, obesity, pregnancy, that is preeclampsia, various renal diseases like renal vascular disease, parenchymal renal disease, particularly glomerulonephritis, polycystic kidney disease, endocrinal disease like pheochromocytoma, Cushing syndrome, primary hyperaldosteronism, etc., and various kind of drugs like oral contraceptives containing estrogen, anabolic steroids, corticosteroids, and NSAIDs. So in the previous slide, we have discussed about the primary hypertension causes. In this slide, we have discussed about secondary hypertension causes. I will again repeat the secondary hypertension causes: alcohol, obesity, pregnancy, that is preeclampsia, various kind of renal diseases like renal vascular disease, parenchymal renal disease, particularly glomerulonephritis, polycystic kidney disease, various endocrinal diseases like pheochromocytoma, Cushing syndrome, and primary hyperaldosteronism, and various kinds of drugs like oral contraceptives containing estrogen, anabolic steroids, corticosteroids, NSAIDs, etc. Now, what are the various investigations to be done in case of hypertension? Whenever a patient of hypertension is coming to you, what are the various investigations that could be done? So there are certain investigations that has to be done on all the patients, and certain investigations could be done only on the selected patients. So the investigation that has to be done on all the patients includes urine analysis for blood, protein, and glucose, blood urea, electrolytes and creatinine, blood glucose, total serum and HDL cholesterol, and 12-lead ECG. I will again repeat all investigations that will be done in all the patients. Urine analysis for the blood, protein and glucose, blood urea, creatinine, electrolytes, blood glucose, serum total and HDL cholesterol, and 12-lead ECG. Now there are certain investigations that has to be done on the selected patients only. That includes chest X-ray for cardiomegaly, heart failure, coarctation of aorta, ambulatory BP recording, echocardiogram to detect the quantify left ventricular hypertrophy, renal ultrasound to detect the possible renal disease, renal angiography to detect or confirm the presence of renal artery stenosis, urinary catecholamines like pheochromocytoma, urinary cortisol and dexamethasone suppression test, plasma renin activity, and aldosterone. Now, how will you manage the case of hypertension? So there are two methods. Number one is non-drug therapy, and the second one is drug therapy. So in case of non-drug therapy, when you are not giving any kind of medicine, you have to ask the patient to take appropriate lifestyle measures like correcting obesity, reducing alcohol intake, restricting the salt intake, taking regular physical exercise, and increasing consumption of fruits and vegetables. There are various drug therapies like antihypertensive drugs that includes thiazides and other diuretics, ACE inhibitors, angiotensin receptor blockers, various calcium channel blockers, and beta blockers. So this was all about hypertension. In the next lecture, we are going to discuss about infective endocarditis. This session was powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.